The health and medical information provided during this webinar, as well as the questions and responses from the webinar providers, are solely for informational purposes. This content is not intended to take the place of advice or treatment from health professionals. Nothing presented in the webinar is intended to be used for medical evaluation, diagnosis, or treatment. It is not intended to substitute for your relationships with your own healthcare and pharmaceutical providers. Always seek the advice of your healthcare provider before beginning any new treatment, or if you have questions regarding a medical condition.
For sure. It's a good review question here. So if all goes well, how long after surgery, prostate removal surgery, would you expect a full erection recovery? I guess there's kind of two surgeries in there, but.
And what can you expect as far as a timeline for erectile function recovery? It just really depends. And I would actually say that that's not the point, is when should I expect it to come back? When you want to have sex after your prostate cancer procedure is the time you should be able to have sex. So if and usually it's your urinary leakage is almost gone or gone all the way, and you're like, okay, now's the time. We've been waiting too long. Let's get back at it. Do the pills. Pills don't work. Consider the injections. Consider the implant. Usually for an implant, I will wait a little bit longer unless someone's like, I need to get this done and my life depends on it. You know, my relationship is not going to actually survive this issue. There's some relationships that a lot of the definition of their relationship is physical, and there's nothing wrong with that. But you know, it is individualized what I say to the person in front of me. I take into account, you know, what type of procedure they had, were their nerves spared, what kind of erectile function they had prior to the procedure, and then what are their goals with regards to their relationship. We take in all those different factors, and then we apply what our counseling is. You know, if you don't have good erections before the procedure, probably not going to come back. I mean, nobody's going to get better erections after they have the prostate out. Now, if you have perfect erections, then it goes to the next thing, which is age. The younger you are when you have the prostate procedure, you are more likely. So if you're in your 50s, someone who's in their 50s who gets a prostate procedure, had good erections, is going to recover their erection better than someone who's like 65 to 70 who had perfect erections beforehand and underwent the procedure. You got to take into account if they have high blood pressure, diabetes, other issues that may lead to erectile dysfunction and prevent them from recovering and their nerve regrowth. So unfortunately, it's not a simple answer to say like when exactly or to predict. The general information is that if you have good erections, you have about a year and a half to get back your erections with help. It's not just by themselves, it's with help. It's with essentially tadalafil or Viagra. So you need to use that as you're recovering. And then some people are able to come off it. Some people are not. However, if you're dissatisfied with your therapy and you're at a year and you're like, now's the time, it's unlikely after a year that you are actually, if you had no action down there and it's not even getting partial erections, that you're going to recover. If you just keep on waiting, nothing's working with the pills, you got to move on. I mean, it's just one of those things where if you need someone to say to you, move on, I'm saying it right now. It's sort of like you have to direct what's important in your quality of life and make that known to whoever's seeing you and make them address that. And so if they say, hey, no, it's way too early, wait, you have to be okay with it or find someone who will do what you want. When it comes to erectile dysfunction and the urinary leakage, you guys, I say this to all my patients, like, you guys are the captains. I'm the first mate. I can tell you where to go, but I can't make the decision on what direction to choose. I can tell you which directions you can go in, but ultimately that direction of what you choose is you, because I'm not at home with you guys when you're living your life. That's a decision for you to make for your own quality of life. Only you can define that. So that's really where I come from. Some other people may take a different road and approach in counseling, but it's pretty close to that for most sexual medicine therapists.
Alrighty. Next question here, which I thought was a pretty good one. We're going to have time for about one or two more, but this one is, can sperm be harvested after prostate removal?
Sperm can be prostated after removal. That's my other thing I did in my fellowship is reproductive medicine. And so you are continually making sperm. from your testicles, and they go into your vas deferens, which is where you get a vasectomy, and it goes all the way out to the seminal vesicle. The seminal vesicle sits behind the prostate. That's removed at the time of your prostate procedure. So usually the testicles are still producing sperm. Now, depending on what age you are, the health of that sperm may decline as you age. However, there's plenty of people that can still father children, 50s, 60s, 70s. It's just a lowered chance over time. If you're on like testosterone replacement therapy, chance of harvesting sperm is essentially zero, because that will affect your fertility pathway. If you receive radiation or hormone therapy to cut your PSA level down, which basically puts your testosterone down to zero, your fertility will suffer for those reasons as well. So if you are 50s and you get your prostate out and you still want to father children, or you want to harvest your sperm, you can do that.
Wow.
Alrighty, perfect. I think this is an interesting question, but I guess what, if anything, can someone do to keep their PSA low, at zero or below, they say, but I guess just as a general wrap-up question, what can people do lifestyle-wise to maintain their prostate health?
So great question. There's multiple things. What it really comes down to is good diet and exercise. I think everybody understands that what good diet and exercise is, but it may be hard to do. There are thoughts that there's something called phytoestrogens. There's some supplements. There's things that can help shrink the prostate. Usually, when it comes to prostate health, there's two different things. Is it prostate enlargement or is it prostate cancer? Because the prostate enlarges and causes urinary issues. That's one thing with prostate growth. And then prostates can develop prostate cancer. Now, prostate cancer can be hereditary, can be higher risk if either your brother or your father, or some first-degree relative has prostate cancer. That can increase your risk of having prostate cancer. People who are Black race can have an effect on prostate cancer development, and so can age. Generally, if you have a general healthy diet, that is the predominant recommendation, but you have to do it for years at a time to decrease the inflammation in your body, because inflammation, we think, is one of the key risks to developing prostate cancer. Now, there is a prostate cancer prevention trial that was published in the 90s that has the use of finasteride, which is something that can shrink your prostate, and they found that some men will have decreased risk of developing prostate cancer, but it's really the low-risk prostate cancers. The high-risk prostate cancers may occur regardless, but the lower-risk prostate cancers may be prevented by the use of finasteride. We also found that maybe testosterone actually may have some protective benefit. Now, that testosterone use, that issue has not been panned out quite yet, but they did find people who have lowered testosterone levels at the time of presentation may have higher degrees of prostate cancer. That by no means means that you should go and do testosterone, especially if you don't need it, as a means to prevent prostate cancer, because prostate cancer is generally under the control of testosterone. Now, if you're going from a low normal to a higher number, usually that doesn't create a risk for prostate cancer. I don't think testosterone leads to prostate cancer growth, unless it's a really specific situation, which is extremely uncommon now. So I know that's a little bit of a tangent, but generally a good diet and exercise and keeping the body at a general lower level of inflammation, which can be difficult in a Western diet, those things would have the best effect on keeping your PSA low.
If you'd like to learn more about surgical options and see which one might be best for you, you can do this by going to Coloplast. You can also do this by going to menmd.com. We have links directly to Coloplast from there. So you can navigate to either the ED or incontinence pages on MenMD, or you can go to Coloplast, and I'm sure that they have a link right there on their homepage. If you have a question and would like to speak to someone in person, and if your question wasn't answered tonight, rather, you can also call MenMD at 857-233-5837. And this next one is also a perk for MenMD members, but you can log into the password-protected portal to schedule an appointment and have your question answered one-on-one with a personal health assistant. There will also be more resources in the resource center on menmd.com, so you can visit this page to view instructional videos, guides, expert articles, and more about all the treatments and conditions we just discussed.
If you found this video helpful and want to stay in the loop with our growing men's health community, be sure to subscribe to our channel and click the bell to be notified when new content is available. Your support makes it easier for other men like you to find these helpful resources. Thanks again for watching. We hope to see you again.